going to talk about the accidents and emergency department. So, what do we mean by the accidents and emergency department, and what differentiates it from other departments? So, this is a place where we see people. I would liken it to a hotel. When you go to a hotel, there's a reception area where you come in with a problem and someone at the reception sorts you out and sends you to the right direction. So in essence, this is what we do at A&E. But unlike the outpatient department, for us, we usually see cases that fit the definition of what WHO defines an emergency as. So anything that is a threat to life or to a limb is what you see, is what we see as an emergency. So when you come in, if you're out there and you feel it could be sudden, it could be coming on slowly, anything, could be a headache, could be a cough that you feel is threatening your life, either your life or your limb, these are the conditions that we see. So if anyone gets a heart attack out there, if someone gets involved in a road traffic accident and they're bleeding, that is a threat to life. Or they have a fracture, that is a threat to a limb. So you come in and we see you. Now, what do we exactly do at the emergency department? Our role here is to do the initial assessment. So we try to assess you to see whether, yes, is there a real life threat to you? And if it's there, we give you initial management and stabilization. So if you come in, for example, someone comes in with a stroke, someone picked them up from a street and they're unresponsive, you'll come in, we shall assess you and see whether you have anything life-threatening. At that point, if you need anything, say, you need to find out, maybe you had a bleed in the brain, we shall do a brain CT scan to find out whether that is a problem, and we shall send you to the right specialty to take care of you. Now that brings me to the next point. What are the outcomes when you come to the department? So if you come in with a severe headache, yes, we've assessed you, then we have given you initial treatment that can take, for example, for headache, take the form of pain control. So we give you pain relief, the headache goes away, but that is not the end of the story. You might need to see someone, say a neurologist. So we'll link you up to the neurology department and you'll be able to see this person in the physical. So that's what we usually do. And patients come in depending on how severe their condition is. We can actually treat them at the emergency department if their condition is not as severe, and we send them back home. Or if the condition is not so good, we can admit you, and depending on the severity of the condition, we can either send you to the inpatient department, you can be seen by our physician and other specialties, or we can take you to the intensive care unit or high dependency unit if you're really, really sick. These patients that come in and they're really unresponsive, they're really, really, really sick, those ones are better seen in the ICU or HDU. But in the interim, we are the people you'd want to see to stabilize you before you go to the right places. So that, in essence, is our role as the accidents and emergency department. There's so many service providers out there in the country that have departments such as here, but the uniqueness that we have is that we are the only center here in Uganda that has full coverage of the emergency unit by emergency physicians, certified emergency physicians. Other hospitals have basically general doctors that house, run the activities in the A&E, but C-Care has invested in the department and has hired full-time emergency physicians to see patients that come in. So the difference is emergency physicians have, on top of being general doctors, have added in an extra 3 years of specialization to do what they call masters in medicine, emergency medicine. So these are the people that are now specialized in seeing these emergency conditions. So that's where we lie at C-Care, IHK. We have these full-time, and when you come in, you'll be seen and met by an emergency physician.